Bismillahirrahmanirrahim. Assalamu alaikum everyone. My name is Madia. I am from Biotechnology and University of Management and Technology. Today my presentation topic is antipsychotics drugs. The contents are introduction, mechanism of action, types, common uses, adverse effect, pharmacokinetics, drugs interaction, novel approaches, future direction, and conclusion. The first point is definition. Antipsychotics drugs are also known as the neuroleptic leptics are the class of the medication used to treat the psychotic drugs, including the schizophrenia, bipolar disorders, and certain type of the depression. They are the primarily prescribed to have the many symptoms such as the hallucination, delusion, disorganized thinking, and emotions disturbance associated with this condition. Classification: antipsychotics drugs are also known as the neuroleptics are the class of the medication primarily used to treat the psychotic drugs such as the schizophrenia and bipolar disorder. These are the medication work by the targeting and modulating various neurotransmitter system in the brain to have the alleviate symptoms of the psychosis. Antipsychotic drugs can be classified into two main categories. The first is typical antipsychotics, and typical antipsychotics are also known as the first generation antipsychotics. Were the first medication developed to the treat psychosis. They primarily block dopamine receptors in the brain, especially the D2 receptor subtypes. Some commonly used typical antipsychotics include chlor, chlorpromazine, haloperidol, flopenzia, and thyroidazine. Atypical antipsychotics drugs are also known as the second generation antipsychotics or a newer class of the medication that were developed to address the limitation of antipsychotics. These medications have the broader mechanism of action targeting multiple neurotransmitter systems, including dopamine and serotonin, and atypical antipsychotics drugs are often preferred due to their potentially reduced risk of certain side effects compared to the typical antipsychotics. Some commonly used atypical antipsychotics include risperidone, olanzapine, quetiapine, aripiprazole, zyprasidone, clozapine. Historical background: antipsychotic drugs, also known as the neuroleptics, have a significant historical background in the treatment of the psychiatric drugs. His disorders here are the overview of first generation antipsychotics. The development of antipsychotics medication began in the 1950s with the introduction of the chlorpromazine, the first wide used antipsychotic. Other first generation antipsychotics include haloperidol and the flopenzia. These medications were effective in the reducing the positive symptoms of the schizophrenia, but had the significant side effects such as the movement disorders. Dopamine hypothesis: the disorders of the dopamine hypothesis in the 1960s revolutionized the understanding of the antipsychotics action in purpose that excessive dopamine activity in the certain brain regions contributes to psychosis. This hypothesis guide the development of the subsequent antipsychotics medication. Second generation antipsychotics in the 1990s, a second generation antipsychotics, also called atypical antipsychotics, were introduced. This medication including clozapine, risperidone, and the olanzapine, targeted both the dopamine and serotonin receptors, offering improved efficacy and fewer movement side effects compared to the first generation antipsychotics. Evolution of the treatment approaches. Over time, the use of antipsychotics medication expanded beyond schizophrenia to include the other psychiatric conditions such as the bipolar disorders and major depressive disorders with the psychotic features. Antipsychotics have also been used in the combination with other psychotic psychotropic medication to manage the treatment resistance cases. Ongoing research and development. Research continue to explore the underlying mechanism of psychosis and develop newer antipsychotics medication with improved efficacy and tolerability. Some newer agents, such as the aripiprazole and the brexpiprazole, are the considered third generation antipsychotics. Mechanism of action. Work of antipsychotics in the brain. Antipsychotics drugs are also known as the neuroleptics, are medication primarily used to treat the psychotic disorders such as the schizophrenia and bipolar disorders. They work by targeting various neurotransmitter system in the brain, including the dopamine and serotonin, to help the regulate brain activity and reduce the system of psychosis. However, it's important to note that the exact mechanism of action for the antipsychotic drugs are complex and not fully understood. I will provide a general overview of how these drugs affect neurotransmitter system. The first point is dopamine. Antipsychotics primarily exert their therapeutic effects by blocking dopamine receptors in the brain. Dopamine is the neurotransmitter involved in the regulating mood, motivation, and cognition. Overactivity of the dopamine, particularly in the mesolimbic pathway, is associated with the positive symptoms of the psychosis, such as the hallucination and delusion. By blocking dopamine receptors, antipsychotics help reduce the excess dopamine signaling, which can alleviate these symptoms. There are the two classes of dopamine receptor relevant to the antipsychotics. The first is D2 receptors and D1 receptors. And typical antipsychotics primarily target D2 receptors, and typical and atypical antipsychotics affects both D2 and the other receptor subtypes. Serotonin. Antipsychotic drugs also interact with the serotonin receptors in the brain. Serotonin is an other neurotransmitter involved in the mood regulation, among other functions. Atypical antipsychotics have a higher affinity for the serotonin receptors, particularly the 5-HT2A receptor subtype. This serotonin dopamine antagonism is believed to contribute to the unique efficacy of the atypical antipsychotics, as it can further modulate dopamine signaling in the addition to blocking the D2 receptors. Other neurotransmitter systems, antipsychotics can also interact with other neurotransmitter systems, although their significance may vary depending on the specific medication. For example, some antipsychotics have a affinity for the adrenergic, histaminergic, and cholinergic receptors. This interaction may contribute to the side effect associated with the antipsychotics use, such as the sedation, weight gain, anticholinergic effects. And the other point is type of antipsychotics drugs. The first generation antipsychotics. First generation antipsychotics are also known as the conventional or typical antipsychotics were developed in the 1950s and 1960s. They include medications such as the clopramazine and haloperidol, fluphenazine. First generation antipsychotics primarily work by the blocking dopamine receptors in the brain, specifically the D2 receptors, which help reduce the psychotic symptoms. Efficacy. First generation antipsychotics are generally effective in the managing positive symptoms of the schizophrenia, such as the hallucinations and delusions. They may have been used for the decades and have a long history of clinical use. Side effect of the first generation antipsychotics associated with a higher risk of extrapyramidal symptoms, which include movement disorders like the Parkinsonism, dystonia, and akathisia. Tardive Dyskinesia, a potentially irreversible movement disorders can also occur with long-term use. Other side effects may include sedations, weight gain, anticholinergic linergic effects, and cardiovascular effects, etc. Second generation antipsychotics. Second generation antipsychotics are also known as the atypical antipsychotics were developed in 1990s and onward. They include the medications such as the risperidone, olanzapine, quetiapine, aripiprazole, and the clozapine. Second generation antipsychotics have a broader mechanism of action affecting dopamine as well as the serotonin and the other neurotransmitter in the brain. Efficacy. Second generation antipsychotics are effective in the managing both positive and negative symptoms of the schizophrenia. They are also used to treat the bipolar disorders, major depressive disorders, and other psychiatric conditions. Side effects. Second generation antipsychotics generally have a low risk of the EPS compared to the first generation antipsychotics drugs. However, they are associated with other side effects such as the metabolic effects, weight gain, and the insulin resistance, etc. Increase the risk of the diabetes, sedation, orthostatic hypotensions, and the anticholinergic effects. Effects. Clozapine and the second generation antipsychotics used for the treatment resistance and schizophrenia carries a significant risk of the agranulocytosis and the required regular blood monitoring. Common uses of the antipsychotics drugs. Antipsychotics drugs are the primarily used in the treatment of the schizophrenia and bipolar disorders, but they can also be prescribed for the other psychiatric disorders. Here are the some indications for the antipsychotic drugs. Schizophrenia, antipsychotics are the mainstay of the treatment for the schizophrenia. They help reduce the psychotic symptoms such as the hallucination, delusion, and disorganized thinking. They can also improve mood, cognitive function, and the social functioning. Bipolar disorders, antipsychotics are often used in the treatment of bipolar disorders, both during the manic and depressive episodes. They can help control the manic symptoms, stabilize mood, and prevent future episodes. Some antipsychotics are also used as the adjunctive therapies to enhance the effectiveness of mood stabilizer. Major depressive disorders. In several cases of the depression with the psychotic features, antipsychotics may be prescribed to address the psychotic symptom and provide relief. They are the typical use in the combination with antidepressants medication. And the next point is psychotics disorder due to the substance abuse. Antipsychotics may be used to treat substance induced psychosis, which can occur as a result of substance abuse or the withdrawal. They can help to alleviate the psychotic symptoms and support the individual recovery. The next point is adverse effect. Potential side effect of antipsychotic drugs. Antipsychotic medication are commonly prescribed to the treat various mental health conditions, including schizophrenia, bipolar disorders, and certain type of the depression. While this medication can be highly effective in the managing symptoms, they may also be associated with the certain side effects. Here are the some potential side effects of the antipsychotic drugs. The first is weight gain. Many antipsychotics can lead to weight gain, especially the second generation or atypical antipsychotics. This can be due to increase the A peptide change in the metabolism or alternation in insulin sensitivity. Metabolic changes. Antipsychotics can potentially causes metabolic changes such as the increased blood sugar level, insulin resistance, and dyslipidemia. These changes may increase the risk of the developing condition like the diabetes and the cardiovascular diseases. Extrapyramidal symptoms. Extrapyramidal symptoms are movement disorders that can occur as a side effect of the antipsychotic medications. The symptoms may include muscle stiffness, tremors, restlessness, and that are the examples of the extrapyramidal symptoms. The risk of extrapyramidal symptoms is higher with the first generation or the typical antipsychotics. Increase the risk of the cardiovascular disease. Certain antipsychotics, particularly some of the second generation ones, have been associated with and increase the risk of cardiovascular events such as the heart attacks, strokes, irregular heart rhythms. This risk may be influenced by the factors such as the pre-existing cardiovascular condition, age, and other individual health factors. Pharmacokinetics. Antipsychotics drugs are the medication used to treat the various mental disorders, including the schizophrenia, bipolar disorders, and certain types of depression. When these drugs are taken, they undergo a series of the process in the body, including absorption, distribution, metabolism, and elimination. Here's core overview of this process. The first point is absorption. After oral administration, antipsychotic drugs are absorbed from the gastrointestinal and tract into the bloodstream. The rate and exact of the absorption can vary depending on the factors such as the drug's formulation and the presence of the food in the stomach and the individual variation. Distribution. Once the absorbed antipsychotic drugs are distributed throughout the body via the bloodstream. They can cross the blood-brain barrier, allowing them to reach the central nervous system and exert their effects on the brain. Antipsychotics also distribute to other tissues such as the liver, kidneys, and adipose tissue. The second point is metabolism. Metabolism, the liver in the liver, antipsychotic drugs undergo various metabolic process. The primary purpose of the metabolism is convert the drugs into the metabolites that can be more easily eliminated from the body. This major enzyme system responsible for the metabolizing many antipsychotics in the cytochrome system, particularly the cytochrome system 1A2 and CYP2D6 enzymes. Different antipsychotics have the varying degree of the metabolism and can be classified as either primarily metabolized or the renally eliminated. Elimination. The final step is the process is elimination of the antipsychotic drugs and their metabolism from the body, metabolites from the body. Elimination primarily occurred through the kidney with a portion of the drugs and its metabolites excreted in the urine. Some antipsychotic drugs also undergo the biliary excretion where they are eliminated through the bile into the feces. The elimination half-life, which represent the time it takes for the half of the drugs to be eliminated from the body, can vary significantly among the different antipsychotics. The second on the next point is drugs interaction. Interaction between the antipsychotic drugs and other medications. Alcohol. Drinking alcohol while taking antipsychotics medications can have the addictive effects on the central nervous system, leading to increased drowsiness, sedation, and impaired judgment. Alcohol can also reduce the effectiveness of the antipsychotics medication, potentially worsening and the symptoms being treated. It is the generally recommended to avoid or limit alcohol consumption while taking antipsychotics. Sedative. Combining antipsychotics with the sedatives can result in increased sedation and the central nervous system depression. This combination can causes the excessive dorsiness, impaired coordination, and slowed breathing. It is the crucial to use this metabolism medication together with caution and under medical supervision. Antidepressants, some antipsychotics may interact with the certain antidepressants such as the selective serotonin reuptake inhibitors, tricyclic antidepressants, or the monoamine oxides inhibitors. These interactions can potentially increase the risk of the serotonin syndrome or potentially life-threatening condition characterized by the agitation, confusion, rapid heartbeat, high blood pressure, and the tremors. Your doctor will closely monitor your medication regimen if you are taking both antipsychotics and antidepressants. Other medications. Antipsychotics can interact with the various other medications, including the certain anti antihistamine and anti-seizure drugs, antibiotics, and the antifungal medication. These interactions can affect the level of the medication in the blood, potentially leading to decreased effectiveness and decreased side effects. It is important to inform your healthcare provider you about all the medication you are taking to identify and manage any potential interaction. Novel approaches. Antipsychotic drugs are primarily used to treat psychiatric drugs disorders such as the schizophrenia and bipolar disorder. Traditionally, antipsychotics, known as the typical antipsychotics, primarily target dopamine receptors in the brain. However, these drugs often common with the side effects such as the extrapyramidal symptoms and the tardive dyskinesia. Recent developments have the focused on the development of atypical antipsychotics which target multiple neurotransmitter system, including glutamate and GABA. Glutamate is the primarily excitatory neurotransmitter in the brain, while GABA is the primarily inhibitory neurotransmitter. Here are the some notable advances in the development of the antipsychotic drugs targeting this neurotransmitter system. Here are the some notable advances in the development of antipsychotic drugs targeting this neurotransmitter system. Glutamate system targeting NMDA receptors. NMDA receptors modulators have shown promise in the treatment of schizophrenia. These drugs, such as the ketamine and memantine, work by the modulating glutamate transmission through the NMDA receptors. They have shown rapid acting antidepressants and antipsychotics effects. Also, their long-term safety and efficacy are still being investigated. The second is GABA receptors modulators. Some antipsychotic drugs, such as the benzodiazepines, work by the enhancing the effect of the GABA at its receptors. However, these drugs are not typical use as the first line treatment for the schizophrenia due to their sedation property and mutation for the abuse. GABA agnostics. This is the ongoing research in the developments of the selective GABA agnostics that can specific target certain subtypes of the GABA receptors. These compounds may have the potential as the future antipsychotics treatment. Other neurotransmitter system, serotonin dopamine modulator. Some atypical antipsychotics such as the aripiprazole function are the partial agnostics are at the dopamine receptors and also modulate the serotonin receptors. These drugs aim to achieve a balance between the dopamine and serotonin transmission to reduce the system of psychosis while minimizing side effects. Histamine receptors modulate. Recent research has also explored the role of histamine receptors in the antipsychotic effects. Drugs that modulate histamine receptors, such as the carbamazepine, are being investigated for their potential is targeting schizophrenia and bipolar disorder. It's important to note that the development of the few antipsychotic drugs is a complex or the ongoing process. While advances have been made, further research is necessary to better understand the underlying mechanism of psychiatric disorders and improve the treatment of options for the patient. For the most up-to-date information or the recent advance in the antipsychotic drugs developments, I recommended consulting scientific lecturers or the speaking with a medical professional. Future direction. In the field of the antipsychotic drugs, there are the several potential areas of the research and developments focused on the personalized medicines and precision psychiatrics. These areas aim to optimize the treatment of the individual with a psychotic disorder such as the schizophrenia and bipolar disorders by the tailoring interventions to their specific needs. Here are the some potential area of the research and developments in this domain. First is the pharmacogenomics. Genomics investigates the genetics variations that influence an individual response to medication by identifying a genetics marker associated with the drug's response. Adverse effects research can develop associated with the drugs can develop genetic uh, test to guide the treatment decision. This field holds a promise for the predicting an individual response to the antipsychotics medication, helping to select the most effective and safe treatment option. Biomarkers research is ongoing to identifying reliable biomarkers for the psychiatric disorders. Biomarkers could include the genetic, biochemical, neuroimaging, or the psychological measure that can predict treatment response or diseases progression. By using biomarkers, clinical clinicians could determine the most appropriate antipsychotics medications and dosage for the individual, leading to improve the outcomes. Digital health technologies such as the smartphones, apps, and the wearable devices offer opportunities for the real-time monitoring of symptoms, medications, adherence, and treatment response. These technologies can collect large amount of data that can be analyzed that provide a personalized treatment recommendations. Integrating in digital health technologies with antipsychotic drugs developments can enhance the precision and effectiveness of treatment strategies. Machine learning and effective effective intelligence technologies can be applied to large data sets to identify patterns, predict the treatment response, and develop personalized treatment algorithms by analyzing data from multiple sources, including the clinical records, genetics profiles, and the neuroimaging data. These approaches can help the clinicals make the informed discussion about the medication selection and dosing. Clinical trailers designs. Improving the design of clinical trailer for the antipsychotic drugs can enhance the precision of treatment and adaptive clinical trailer designs, for the example, allow for adjustment in the treatment arms and sample size based on the real-time data. These designs enables the identification of subgroup of patients who responds better to specific medication or treatment strategies, facilitating personalized medicine approaches. Combination therapies. Antipsychotics medication are often used in combination with other treatments and modalities such as the interventions or cognitive behavior therapy. Research is needed to determine the optimal combination and sequencing of the interventions to improve the outcome for the individual with the psychiatric disorders. Precision psychiatrics aims to identify specific patients' characteristics that predict response to different combination, allowing for the tailored treatment plans. Conclusion. Key points. Antipsychotic drugs are widely used in the treatment of the psychiatric disorder, particularly schizophrenia and bipolar disorders. They work by blocking dopamine receptors in the brain, reducing the psychotic symptoms. Antipsychotics also have effects on the other neurotransmitters such as the serotonin and glutamate, which may contribute to their efficacy and side effects. First generation antipsychotics primarily target dopamine receptors and are associated with a higher risk of the extrapyramidal symptoms. Second generation antipsychotics have the broader receptor profiles including the dopamine and serotonin receptors and are the generally associated with the lower risk of the extrapyramidal symptoms but a higher risk of metabolic side effects. Antipsychotics are associated with the potential side effects, including weight gain, metabolic changes, extrapyramidal symptoms, increased risk of cardiovascular diseases, and other. Interaction with other medications, substance, and lifestyle factors can affect the effectiveness of and the safety of antipsychotic drugs. In applications for the clinical practice, individualized approach treatment plans should be tailored tailored to the individual specific diagnosis, symptoms, medical history, and treatment response. The choice of antipsychotics medication should consider the balance between the efficacy and side effect profile. Regular monitoring. Ongoing monitoring is essential to assess the treatment response, managing side effects, and adjust medications does as the needed doses as the needed. Monitoring parameters may include physical health indicators, weight, blood pressure, metabolic parameters, symptomology, and treatment adherence. Patients education. Patient should be educated about the potential side effect of the antipsychotics medications, and the importance of the adhering to the treatment. They should also be aware of the potential drugs interaction and the risk of associated with alcohol and substance use. Colla- collaborative cares, multidispensaries, dispensary collaboration between the psychiatrics, primarily care psychiatrians and other healthcare provides is important to address the comprehensive needs of individual taking the antipsychotics medications. This may involve coordinated monitoring of physical health, psychological support, and the addressing medication in adherence. Shared decision making. Involving patient is shared decision making can enhance treatment adherence and satisfaction. Healthcare professionals should engage in the open, transparent discussions with patients, provides information about the treatment options, potential benefits, and risk. Emerging therapies. Stay updated on the latest research and developments in the antipsychotics medication. The drugs targeting the glutamate, GABA, and other the neurotransmitter system may offer the additional treatment options in the future, potentially improving the efficacy and minimizing side effects. And the reference of the antipsychotic drugs are here. You can you can search any book from this reference. Thank you so much for watching this video. Allah Hafiz.